Okay guys, this is going to be your tracheostomy care and suctioning skill that's coming up here. This is a little bit different on your checklist from the way they do it on ATI. So we're going to do a short video to show you how we do it so that it matches your skills checklist. But just know, like we say, there's always more than one way to do a skill. So, all right, so you're going to start with suction first. So if you look at your checklist, you're going to do all your beginning steps. You're going to introduce yourself. You're going to provide for privacy. Place the client in semi-Fowler's position, okay? And you need to do a pre-respiratory assessment before you suction, because you need to listen to lung sounds, you need to do vital signs, check pulse ox. If they're on a cardiac monitor, you're gonna monitor their rhythm, okay? Remember, we only suction on a PRN or as needed, so how do we know we need to suction? We need to listen to lung sounds, or if your patient's coughing, etc., etc. So, semi-Fowler's, okay? Our patient here has oxygen, okay? So in order to get them ready, you're gonna make sure that they're attached to an oxygen device, and you're gonna adjust that to 100%. So you can see our oxygen collar here. We need to turn it up to 100, and the way you do that is go all the way up to 15 liters, okay? That gives them 100% oxygen. Yeah. So we are hyperoxygenating them when we give them 100% oxygen. The reason why we do that is because when we suction, we're going to be taking some oxygen from the airway. So we want to hyperoxygenate at the beginning, and we do that by turning it up to 100%, okay? So you're also going to need an ambu bag, because we are going to hyperventilate our client also, okay? When we hyperventilate, that helps them to, this is also hooked up to an oxygen source at 100%, and we will provide them breaths with our ambu bag when we get ready to suction. This also helps get 100% oxygen down into their lungs. So there's a difference between hyperoxygenate with our mask here, and then we actually hyperventilate, okay? When the clients can't do it on their own, that's when we have to do it with the ambu bag. Now, if you have a client who's alert, or a patient who's alert, and they can take deep breaths on their own before we suction, then they can hyperventilate themselves. But for your checkoff, you're going to hyperventilate with our ambu bag, okay? So when we get there. But know the difference between hyperventilate and hyperoxygenate, okay? All right, so what we're gonna do for suctioning, we're going to, we're on step 4. So you're going to open your suction catheter kit, okay, and our basin, and we're going to get that ready. Okay, so we make sure our table's clean, our hands are clean, and then you should have a suction catheter kit in your bag. Okay, as we open all supplies, we open them away from us because we want to keep this as sterile as possible. You can lift this whole thing out here, and you can throw this away to get that out of your way. What you want to do is remove the basin, which is usually on top, and then you just take it at the corners and you push it together, okay? You cannot touch the inside. That has to remain sterile for your liquid, okay? And just make sure your bottom is together, okay? And all you do is just kind of squeeze it together. You cannot stick your fingers down in there to get that together, okay? And so we're going to set that there. Then you're going to use sterile normal saline as your irrigation solution for your catheter. So again, this is good for 24 hours. Make sure it's labeled as such. If it's no date, you're gonna throw it away and get a new one, okay? So we're gonna take the lid off, put it right side up as we always do. We palm the label. If it's already been opened, we're gonna cleanse the lip. If it's brand new, you don't have to cleanse the lip. Okay, and now you're gonna pour. You can make it about halfway full. And the plastic in your box usually does kind of fall down once you pour the liquid into it. And then you can put the lid back there and put that away, okay? So now we're going to, you can put a towel across the client's chest to catch any kind of drainage or anything. You can wear goggles. You can wear a mask, you can wear a gown if you suspect that there's going to be a lot of phlegm or secretions, okay, to protect yourself. So we're going to open up our kit, and then we'll have to put on our sterile gloves. So your gloves are included right on top of your kit. For those of you, remember that the gloves that come with kits don't work. You can just bring a separate package of gloves, open those up, put those on, and then you can just throw these off, okay? I want to go this way and put my other glove on. Sorry about that. I just picked it up. Okay, once you get your gloves on, everything inside here is sterile. You're gonna pick up the inner package, okay? I'm going to take out the catheter, and right now I'm touching sterile to sterile, but you are gonna have to dirty one hand, so to speak, or make one hand unsterile, okay? Because we're going to have to turn on our suction, and I'm just gonna turn it on to regular, okay? And adjust our suction pressure, okay? Usually no more than 100 for infants and no more than 120 for children and adults, and you adjust your suction by using this dial here. Okay, so this one's way up there. So I'm just gonna put it down here between 100 and 125. You turn it to regular, that means continuous suction. If we needed intermittent, you would turn it the other way to the INT. But when you're suctioning somebody, you need continuous suction, so it goes on to the regular. So once I touch this suction tubing here, this hand is now dirty or unsterile. So then you just have to put these together. Be careful when you're putting them together that you don't touch your dirty over here with your sterile hand, okay? And I usually kind of try and wrap it around my pinky there. And what you want to do is lubricate your catheter. You have to control your suction by using your thumb, okay? If your thumb is down, suction is on. Suction is on, suction is off. So you can tell when I lubricate, suction is on because it's coming up through the tube, and suction is off, okay? So then this is where I'm gonna wrap it around my finger here to hold it and keep it sterile. Keep in mind, don't get it close to your clothing, okay? This is where we need to hyperventilate. So we have to move the oxygen over, okay? And this is where we take our ambu bag turned up to 100% oxygen, and we give 3 to 5 big breaths. And if you have an assistant that can help you with this, you can also use an assistant. Sometimes it's hard to do one-handed, okay? So I'm hyperventilating them because they can't breathe in on their own. And then I'm going to insert my suction catheter, but notice my thumb is off suction because we do not suction on the way in, only on the way out. You insert your catheter until you meet a little bit of resistance. They may even start coughing, okay? And then on the way out, I'm going to apply suction intermittently, which means on-off, and I'm also going to twist it between my thumbs. You only want to apply suction for 5 to 10 seconds, okay? And only on the way out. So as soon as I get that catheter out, I'm going to just hang it on my pinky here because I'm going to want to use this hand to go ahead and give them their oxygen back, okay? And they're having oxygen back and resting while I go over here and I apply suction to clean my tube out, okay? And then I can hang it back here. You can do suction 2 to 3 times, okay, as needed. But you need to give them the suction back in between and let them rest about 1 to 2 minutes in between your suction passes, okay? So he's rested 1 to 2 minutes. If he needs suctioned again, I can remove this, okay? I can take my ambu bag, give 3 to 5 big breaths with my ambu bag, okay? And then I insert my suction catheter and then intermittently suction on the way out only, twisting it between my fingers, taking no more than 5 to 10 seconds. And then I go ahead and give him his oxygen back so he can start recovering. And then you need to rinse your tube because you don't want this gunk to stay in your tube. It'll clog it up. And then the whole time I can monitor his pulse ox. If I have a pulse ox on his finger or if he's on a monitor, I can also watch his rhythm strip, make sure he's not having any cardiac dysrhythmias. And then I can do it one more time. This would be my 3rd time if I should need to. Okay, Then I'll give him 3 to 5 big breaths with my Ambu bag. Okay, and then insert my suction catheter, and then suction intermittently on the way out, no more than 5 to 10 seconds. Give him his oxygen back. And then the last time, since I'm already done, I've done my 3 times, you want to just use the rest of your liquid to go ahead and clean out your tube. So when you check off, just go ahead and suck the rest of the liquid up. And then you turn off your suction. This tube stays on the wall. Your actual suction catheter can go in the trash with your gloves. And then you turn their regular oxygen back down to their normal prescribed rate. Okay? And then when you're done suctioning, you're going to do a post-respiratory assessment, just like we did when we started. We're going to listen to lung sounds, check vital signs, check pulse ox, because you want to know that your suctioning was effective. So you have to do that post-respiratory assessment. So you're going to document for your suctioning how many times you suctioned, what suction pressure you used, how your patient tolerated it, how much secretions did you get out, and what did they look like? What color were they? What was your pre-assessment lung sounds and vitals, pulse ox? What's your post-assessment lung sounds and vitals? Okay, so that's your suction portion. And then for your check off, you're going to go right into your trach, and we'll post that in just a minute.